Hello everyone, welcome back to Sowkya Vision. Today we are going to see brachial plexus. In the previous class we have completed axilla, axillary artery and the scapular anastomosis. Yes, today we are going to see the brachial plexus. Yes, what is plexus? Plexus is nothing but it's a network. Yes, plexus is network. So brachial plexus means it is a network of nerves in the brachium, that is in the upper limb. Yes, so brachial plexus, it is the network of nerves that supplies the upper limb. It is known as brachial plexus. So what are involved in the formation of brachial plexus? They are anterior rami of lower four cervical and first thoracic spinal nerves. Yes, the brachial plexus is formed by last four cervical spinal nerves and first thoracic spinal nerves. So, how many cervical vertebra are there? See, there are 7 cervical vertebra, but the nerves arising from their segments is 8 cervical nerves. Yes, there are 7 cervical vertebra, but the spinal nerves arising are 8 cervical. How? See, for example, C1, C2, C3, C4, C5, C6, C7. These are the vertebra. Yes. Now, the C1 arising from here, C2 here, C3 here, C4 here, C5 here, C6 here, C7 and C8 from below C7 vertebra. So it is called subcervical nerve. Yes, it is arising below the cervical vertebra, right? So it is called subcervical nerve. So this is a C1 spinal nerve, C2 spinal nerve, C3 spinal nerve, C4 spinal nerve, C5, C6, C7, C8 spinal nerves. Here it is why the cervical vertebra are 7 but the cervical spinal nerves are 8. So the brachial plexus is formed by last 4 cervical spinal nerves and the first thoracic spinal nerve. So what are the last 4 cervical nerves? They are C8, C7, C6 and C5 and the first thoracic spinal nerve. So the plexus the plexus formed from the spinal nerves is cervical plexus. See, there are cervical vertebra, thoracic vertebra, lumbar vertebra and sacral vertebra, right? So from every spinal segment nerves, plexus are formed. See, from cervical there are cervical plexus. Yes, from thoracic there is no formation of plexus because these spinal nerves supply to the viscera. Yes, these spinal nerves from the thoracic segments supply to the viscera. So the thoracic segment of thoracic spinal nerves doesn't form any plexus. And lumbar and sacrum forms, sacral spinal nerves forms lumbosacral plexus, lumbar plexus and sacral plexus. But thoracic plexus is not existed. The thoracic spinal nerves supply to the viscera. So there are cervical plexus, lumbosacral plexus but no thoracic plexus. Yes, here we go. The spinal nerves that are involved are C5, C6, C7, C8 and first thoracic spinal nerve, that is T1. So that the spinal nerves forming brachial plexus extending from C5 to C8 and T1. So sometimes there will be a slight contribution of C4 or T2. Yes, there will be sometimes contribution of C4 or T2. Let's see, for example, if the C4 is present, the root value of the brachial plexus will be C4, C5, C6, C7 and C8. Yes, sometimes there will be the contribution of T2. Sometimes there will be contribution of T2. Then the root value will be C6, C7, C8, T1 and T2. Yes. Now, what is prefixed brachial plexus, post-fixed brachial plexus? As I said, where the C4 spinal nerve is involved in the formation of brachial plexus, that is called prefixed brachial plexus. Sometimes T2 is involved in the formation of brachial plexus where the C4 is completely absent. The contribution is C4 is absent but T2 is present. There we called post-fixed brachial plexus. Yes, prefixed means C4 is present, T2 is completely absent. Post-fixed means T2 is present and contribution of C4 is completely absent. Yes, now components. What are the components that are going to form brachial plexus? There are 4 major components that are going to form brachial plexus. What are they? There are roots. The roots are the nerves that are arising from the segments, spinal cord. Yes, they are formed into trunks. Yes, roots are formed into trunks, and each trunk is divided into anterior and posterior division, and their combination is going to form cords, which gives branches of brachial plexus. See, there are 4 main components with branches. What are the main components? Roots, trunks, divisions, cords, and finally they are giving branches. Yes, there is a mnemonic to remember the components of brachial plexus. That is, rat take delicious cheese bites. Yes, you just remember this. Rat take delicious cheese bites. From rat, R denotes roots, T for trunks, D for divisions, C for cords, B for branches. Yes, the roots and trunks are present in the neck. Yes, the roots and trunks are present in the neck. And the division is presented behind the clavicle. Divisions are present. What are the divisions? Anterior and posterior division of each trunk is present behind clavicle. Cords are present in the axilla. We have discussed this point in the axilla topic. Yes, the cords of brachial plexus are present in the axilla. Now, let's see each component. Roots. What are roots? These are 5 ventral roots. Yes, what are they? From C5, C6, C7, C8 and T1. Yes, where they are present? They are present behind scalenus anterior. Yes, it is a muscle in the neck region. So the roots are present behind scalenus anterior. Now trunks. The trunks crosses lower part of posterior triangle of neck. See, our neck containing is divided into different triangles to make study ease. Okay, to remember the gross features easily, the neck is divided into triangles. So there is a posterior triangle and anterior triangle majorly in the neck. So the trunks crosses lower part of posterior triangle of neck. So what are the trunks? The trunks are upper trunk, middle trunk, lower trunk. Yes, the upper trunk is formed by C5 and C6. So what are the roots we discussed? C5, C6, C7, C8 and T1. So upper trunk is formed by C5 and C6. Middle trunk is a continuation of C7 root, whereas lower trunk is formed by C8 and T1 roots. Yes, let's see in the diagram. Yes, let's say, one second. Yeah, this is the C5, this is C6, this is C7, C8 and C9. Yes, what I said, the upper trunk is formed by C5 and C6. This is the upper trunk. C7 is continued as middle trunk. Yes, lower trunk is formed by C8 and T1. Yes, this is C5, this is C6, this is C7, C8 and T1, right? So here it is the upper trunk. Yes, here it is the middle trunk, here it is the lower trunk. Now these trunks are divided into again anterior division, posterior division. Yes, anterior division, posterior division, anterior division, posterior division. Yes, listen carefully. Anterior division of upper trunk, anterior division of middle trunk are going to form lateral cord. Yes, this is the anterior division. Let me mark anterior, posterior, anterior, posterior. Here also anterior and posterior. So the anterior division of the upper trunk and anterior division of middle trunk are going to form lateral cord. Yes, now the posterior division. See, anterior division of upper trunk, anterior division of middle trunk is completed. What we have in rest? Posterior, and one anterior trunk of lower. So the anterior division of lower trunk is continued as medial cord. Yes, medial cord. Now all four posterior divisions are remaining. All three together form posterior cord. Yes, once again let me tell you, upper trunk, middle trunk and lower trunk. Upper trunk, anterior posterior division, anterior posterior division, anterior posterior division. So the anterior division of upper trunk and the anterior division of middle trunk are going to form lateral cord. Yes, now the anterior division of lower trunk is going to form medial cord. Now all posterior division together form posterior cord. Yes, now let's see the branches of these cords. The lateral cord. Yes, the lateral cord is containing three branches. What are the three branches of lateral cord? They are lateral pectoral nerve, it is continued as musculocutaneous nerve, and lateral root of median nerve. Yes, median nerve, it is a nerve. It is a major nerve of brachial plexus formed by two main roots, that are lateral root of median nerve, medial root of median nerve. So the lateral root of median nerve is arising from the lateral cord. Yes, now here we will label it as lateral pectoral nerve. Yes, it is a musculocutaneous nerve. Musculocutaneous nerve, and this is lateral root of median nerve. These are the branches of what? Lateral cord. Yes. Now what are the branches from medial cord? Yes. Now it is extended as ulnar nerve. And another four branches are medial nerve, medial root of median nerve. Let me label it here. Medial root of median nerve. Now next, median cutaneous nerve of arm, median cutaneous nerve of forearm. Yes, medial cutaneous nerve of arm, this is for forearm, and there are 5 branches from medial cord. Yes, now branches from the posterior cord, it is extended as radial nerve, and other 3 branches are upper subscapular, yes, nerve to latissimus dorsi, and lower scapular. Another branch is axillary nerve. Yes, these are the branches from brachial plexus. All three cords. Yes, these are the branches only from the cords. There are branches from the trunk from the upper trunk and also from the roots. So what is the another nerve that is forming from roots? That is long thoracic nerve. Yes, the C5, C6, C7, these three roots are contributed in the formation of long thoracic nerve. Yes, now let's see in the description. As I said, there are 5 roots. Yes, what are the 5 roots? C5, C6, C7, C8 and T1, right? Now, these are presented behind the scalenus anterior and trunk. How many trunks we have discussed? There are 3 trunks: upper trunk, middle trunk and lower trunk. Upper trunk is formed by C5 and C6, yes, and the middle trunk is formed by C7 root. See, this is the upper trunk, right, formed by C5, C6. Middle trunk is a continuation of C7. Lower trunk is formed by C8 and T1. Yes, upper trunk C5 and C6, middle trunk C7, lower trunk C8 and T1. Now, these trunks are divided into anterior and posterior division. See, this is the upper, middle and lower. Anterior, posterior, anterior, posterior, anterior, posterior. Yes. Now let's see the cords. There are 3 cords formed by various combinations of anterior division and the posterior division. See, three cords, right? Lateral, medial and posterior cords. They are distributed as supraclavicular and infraclavicular based on their position. Supra means above the clavicle, infra means below the clavicle. Yes. Now, let's see the cords. What are the cords? Lateral cord. See, this is the lateral cord. Yes, this is the medial cord and this is the posterior cord. How the lateral cord is formed? It is formed by anterior division of upper trunk and anterior division of medial trunk. Is going to form lateral cord. How the medial cord is formed? It is a continuation of anterior division of lower trunk. Yes, how posterior trunk is formed? It is formed by all 3 posterior division of all 3 trunks. Going to form posterior cord. Here, lateral cord by anterior division of upper and middle trunk. Medial cord is formed by anterior division of lower trunk. Posterior cord by posterior division of all 3 trunks. Now, let's see the branches from the roots and trunks. What are the branches from roots? There are 2 main branches. Long thoracic nerve. See, this is the long thoracic nerve, orange color. This is the long thoracic nerve from C5, C6 and C7. Dorsal scapular nerve. Sorry, this is the dorsal scapular nerve from C5. Yes, only from C5. Nerves from the trunks. These are suprascapular, presented above the supraclavicular, presented above the clavicle. What are the 2 branches from the trunks? Suprascapular nerve, nerve to subclavius. See, suprascapular, nerve to subclavius. Yes, now let's see the branches from cords. Yes, what are the branches from the cords? See, the lateral cord. This is the main branch from the lateral cord, and the ulnar nerve is the main branch from the medial cord. Radial nerve and axillary nerve are the main branches from the posterior cord. Yes. How to remember all this? Lateral cord. Lateral cord, the branches are lateral pectoral, lateral root of median nerve. And you have to remember this nerve, musculocutaneous nerve. Yes. So, as the lateral branches present, there are same like medial branches, like medial pectoral. As lateral pectoral, it is a medial pectoral. Lateral root of median nerve, here we contain medial root of median nerve to form median nerve. Yes, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and finally ulnar nerve. You can remember it as M for U. Yes, nerve starts with M, U for ulnar nerve. Now the branches from branches from posterior cord, radial nerve, axillary nerve, thoracodorsal nerve, upper subscapular nerve, lower subscapular nerve. Yes, these are the branches from the cords. Now let's see the applied anatomy of brachial plexus. See, the brachial plexus question asked for short answer as well as it is very important long answer also. Whenever it is asked for long answer, you must write at least 2 to 3 applied part of brachial plexus, in which you have to must attempt the Erb's palsy. This is a major applied anatomy of brachial plexus. Now let's see, what is Erb's palsy? Yes, Erb's palsy means it is a paralysis. It is a paralysis formed due to affection, due to the affection at the Erb's point. Now what is Erb's point? Erb's point is a point where the 6 nerves meet. What are they? C5, C6, subscapular and now to subclavius, and dividing into anterior and posterior division. So this point is known as Erb's point. Here is any defect, any damage at this point leads to Erb's palsy or Erb's paralysis. It is, as I said, the C5 and C6 are going to form upper trunk, right? So it is a upper plexus injury. Yes, it is a upper plexus injury. Now, how it is caused? How it is caused? The excess increase in angle between the head and shoulder. Yes, if the angle between the angle between the head and shoulder is increased. When it will be increased? When we fall and during traction, when a doctor is tracking an arm of a child during birth. Yes, traction of arm during childbirth may increases the angle between head and shoulder. Then the Erb's palsy occurs. So what it leads to? It leads to deformity of upper limb. Yes, what is that? It is a policeman tip hand. So the hand goes like this in the posterior aspect. Yes, the hand goes like this in the posterior aspect as of asking for tip. Yes, the policeman asking for the tip. So what are the effects? It leads to adduction of the arm, medial rotation of the arm, extension of elbow and pronation of the forearm. Yes, these are the effects of Erb's palsy. And now Klumpke's palsy. Yes, it is a Klumpke's palsy or Klumpke's paralysis. It is occurred due to damage of C8 and T1. So C8 and T1 together forming what? Lower trunk, right? So it is known as lower plexus injury. Injury at the lower trunk causes Klumpke's palsy. When it is occurred hyperabduction of the arm. When the arm is over abducted. Yes, when it is over abducted, this palsy occurs. When it is over abducted, when a person fall on outstretched arm. Yes, when a person is fall on outstretched arm, there will be hyperabduction of the arm, more abduction of the arm. So what are the nerves that are damaged in this process? The nerves involved are C8 and T1 that is going to form lower trunk. Yes, what are the effects? Claw hands. This is the claw hand. Claw means what? Bird's claw. Yes, so claw hand formation and loss of sensation along medial border. See, this is a medial border, right? This is the medial border. So loss of sensation. Yes, sensation is completely lost. And Horner syndrome. Horner syndrome involves partial ptosis and meiosis. Yes, these are the effects after in the Klumpke's palsy. Klumpke's palsy is lower trunk injury, whereas Erb's palsy is a upper trunk injury. Yes, this is the complete discussion of brachial plexus. Plexus means what? It is the network of any. It is a network of it may be the network of capillaries, it may be the network of nerves. Here we have discussed the network of nerves, that is brachial plexus. So what are the plexus formed by the spinal nerves? The plexus formed by the spinal nerves are cervical, lumbar and sacral. There is no formation of thoracic plexus. Yes, why? The thoracic spinal nerves are they are supplied to viscera, so they do not involved in the formation of thoracic plexus. There is no matter of thoracic plexus. Yes, this is the brachial plexus. It may be asked for long answer. It is very important long answer, and it can also be asked for short answer. If in case it is asked for long answer, you must write all the branches, their components with the root formula. Root formula is must. You have to attempt with starting with root formula with the pre and post, what we discussed in the C, where the C4 and T2 are involved. You need to mention that, and you have to mention the roots, trunks, divisions, cords separately, and you have to mention the branches from roots and trunks and the branches from cords with the neat labeled diagram, and ending with clinical anatomy, that is applied anatomy. At least you have to mention these two conditions, Erb's palsy and the Klumpke's palsy. Yes, this is the brachial plexus. If you have any question, comment in the comment section. Please do like and subscribe the channel. Thank you.